Hello everyone, welcome to the video series Roadmap to Clinical Proficiency. In this lecture, I would like to give you a brief introduction about medical history taking. Right, before we start, I will ask you a question. So what do you do when a patient comes to your ward? So what are the essential steps you do when a patient comes to your hospital? Yes, you know the answer, right? The first thing you do is you take a medical history, right? What is a medical history? You go to the patient and you talk to the patient and you ask questions and you get details, right? So you ask about their symptoms, right? And then you can get a brief idea about this patient. So that is called history taking, right? Then the next step will be examination, right? So what is examination? Right, so there are four things you do in examination. You inspect, you see from the eyes. You palpate means you touch the patient and see. You percuss, and then you auscultate with the stethoscope, right? You can auscultate the lungs, you can auscultate the heart, right? So this is not the focus of this lecture, right? So I will teach you regarding examination techniques and everything in another separate lecture, right? So today our topic is about history taking, right? So now history, what is the first step I told you? It's the history, right? You talk to the patient. Then the examination, right? With the after you do take the history and after you do the examination, with those two things you can come into a working diagnosis, right? So with the history and examination you get the working diagnosis. Then if somebody asks you, why do you do investigations, right? So why do you do investigations? To confirm your working diagnosis, right? Your working diagnosis you can confirm by investigations. Then what is the second thing? To find an etiology. What is an etiology? Etiology means the cause, right? So then you do investigations. Then you go for the treatment. So treatment can be curative treatment or palliative treatment. So curative means you are trying to cure these patients. You can give medications, you can do surgeries to cure this patient, right? So then comes the palliative treatment. So for palliative means, like, again, you can give medications to palliate pain. Like for example, now let's say there is a esophageal carcinoma patient, so they get dysphagia, that means they are difficulty in swallowing, right? So you can give medications to relieve their pain and you can do surgeries to facilitate them to eat, right? So likewise, that is called palliative care. So treatment can be curative and palliative, right? So this slide is very important, students, right? So you need to have a clear understanding about what is history taking, what is examination, what is investigations, and what is treatment, right? You can't mix up these things and say. Now for example, if a consultant asks you, so tell me the examination findings, you can't tell about history, right? So if they ask about examination findings, you have to tell about inspection, palpation, percussion, auscultation findings, right? So now for example, now if they ask about tell me about this, how do you can diagnose this patient from the history? If somebody asks you, then you have to tell about history details, right? Not the examination findings, right? So then again, if I have seen some students tend to say investigations, like what are the investigations you do? Now for example, now you like say there is some patient coming with some disease. Now you have, what are the investigations you do? You do the basic investigations. You do full blood count, liver function test, then you do scans, right? So those are the investigations, right? Then next is the treatment. So treatment can, again, as I said before, it can be curative and palliative. So this slide is very important, students, right? You can't, once again I'm saying, you cannot mix up these things. Now today our focus will be on history taking. So once again I'm asking you, what is history taking? History taking means you go and talk to the patient. So you build a rapport with the patient, right? So you talk with the patient and get the relevant data, and you produce your information and you present this case to your consultant or a senior person, right? So that is called history taking, medical history taking. So what do you do? Like first, like you have to ask about, like first you have to ask about open-ended questions, right? Open-ended questions. You can ask, why did you come to the hospital? Then they will start telling their story, so that then you can have a clear understanding. It's like a funnel, right? So you have to ask about open-ended. Then you can go for more specific questions. So when you have a brief idea about these things, you can go for the you can ask specific questions to elicit the 7 features of every symptom. Now I will teach you what are these 7 features of every symptom, right? So this is called, so you can ask a specific question. Then finally, yes or no questions, like to get the positive and negative points from this patient's history, and then you can come to a working diagnosis, right? So you remember this, like first you have to ask about open-ended questions, then you can ask specific questions, then yes or no questions to get the positive and negative points from the history. So this is how you take a history, right? Now let's go to the structure of the history. Let's like the basic structure. Don't worry, I will teach you and I will give you some examples of history. Now in this lecture series, what you have to do is you have to have a clear understanding, the skeleton of the history, right? Skeleton. So what are the important things you have to get from these things, right? So first thing you have to get is the patient profile or identifying data, right? So you have to ask about the name, age, hometown, and the occupation. So these are very important things. For example, Mr. Sumanadas, who is 55 years from Mavanalla, like occupation, he's a teacher, right? Likewise, you have to get. So then the reliability, like you have to have an understanding about the patient's memory and the mood, like whether patient is reliable, whether patient is having a sound mind to give the history, right? Then you have to have a understanding about the source of the history, right? So when you are presenting, usually it will be the patient, right? And like for example, now if you are taking a pediatric history, the mother might be giving you the history. So that is the source of the history. So what is the important thing? So first thing in the skeleton, like you can draw, right, students? The patient, the first thing is the patient profile. So identifying data, right? So what other things are there? Name, age, hometown, and occupation, right? So these are the things called patient profile, right? So then you go for the presenting complaint and duration. Students, I have seen most of the students just say only the presenting complaint. They doesn't ask about the duration. That is very wrong. That is a pitfall, students. You have to have a clear understanding about the duration, right? So chief complaint, the one or more symptoms or concerns causing the patient to seek care. So it may be chief one complaint or several complaints, right? So then before we start, we need to have a understanding about what are symptoms and what are signs, right? Mostly in the history taking, we get the symptoms, right? So what are symptoms? If somebody asks you, now pause for a while and think about this. So what if somebody asks you, what is a symptom? So symptoms are objective. Symptoms are subjective. Subjective means what? It differs from one person to another person, right? For example, this can be perceived by only one person, right? So person who is affected. Now for example, now the patient might say, I have pain. So somebody might say like, I have pain, and it differs from patient to patient. Patient say like, now for example, now if you take the pain scale, someone might say, I have a pain like 10, right? But it might be, it only can be perceived by the person. So those things are called symptoms. So to make it clear for you, what are symptoms? What patient says, right? Symptoms are subjective. So what are the things, the words that you need to highlight? Symptoms are subjective, and it is what patient says. What are signs? So signs are the things you can elicit from examination. I told you this is history, and from examination you can elicit. So those are more objective. So signs are the things what can be seen or measured, right, by a medical profession. Now for example, now let's say there is a patient with icterus or jaundice. Like, for example, if you see the sclera, yellowish discoloration of the sclera. So even if I see, or even if you see, that is yellowish discoloration. It's like it's sign. It's not a symptom. It's a sign. So it's more objective, right? So you have if you don't understand, you can comment and see. Like, I will give you more details regarding these things, right? So you have to have a clear understanding about what is a symptom, what is a sign. That is the two different things, right? So you cannot mix up these things. Like in history, we ask for symptoms. So symptoms means what patient says. Signs means what medical professionals can see or measure, right? Can see or measure, right? So next comes the presenting complaint and duration. Right now we spoke about it, right? Next comes history of presenting complaint. So what is the first thing? Now let's go. The first thing, in the skeleton you have the patient profile, right? So patient profile. What is the next one? Presenting complaint and duration. Duration is very important, students, I told you. Now for example, now patient is coming with generalized body swelling for duration. So it may be days, it may be weeks, right? It may be months. Likewise, now abdominal pain for 2 weeks, generalized body swelling for 2 weeks, right? Like chest pain for 30 minutes, right? Likewise, you have to have a chief complaint, right? So that is an example. Right now, in this, now I will take a small example. Generalized body swelling for this much duration, right? Okay, good. Right, history of presenting complaint. So this is very important. So this slide is the one that differs from each and every history, right? So first you can write down. So in the history of presenting complaint, what do you have to do? You have to analyze the symptoms, right? So you have to analyze the symptoms. So though I told you about these 7 attributes, so this come under this, right? So when a patient comes with abdominal pain, there is a mnemonic called Socrates. So I will teach you this when we are talking about separate things. Now here you have to what you need to know here is you have to analyze symptoms. Then exclusion and inclusion of differential diagnosis. You have to have a clear understanding about differential diagnosis, and then you can in the history of presenting complaint you can get an idea. Then etiology. Etiology means what are the causes, right? Then the complications, then the current situation, what are the things you have done, right? Now for example, now to make clear this slide, now I will take that previous generalized body swelling patient, and I will give you some examples, right? Now for example, if we take history of presenting complaint, symptom analysis, right? Now symptom analysis, you can ask about the onset. It may be a gradual onset or sudden onset. Then you have to describe the distribution of edema, whether it's predominantly ascites or generalized edema, right? Then the diurnal variation. Now for example, in heart failure patients, it's the swelling comes predominantly in the evening. In the renal CKD patients or renal failure patients, in the morning, right? So likewise, you have to analyze the symptom, right? Analyze the symptom is need to be done, right? Then the exclusion and inclusion criteria of differential diagnosis, right? For example, now you have to think about what are the things, right? So when a patient comes with swelling, right? Swelling, what are the systems can be affected? So then this you get the idea. So cardiovascular system can be affected. So in the heart failure patients, there may be a swelling, right? So in the respiratory system, so copulmonale patients, what is copulmonale? Right heart failure patients. Like for example, if a patient smokes a lot and they can get this copulmonale, so then these patients also might get swelling. So then the chronic liver disease, right? Chronic liver disease people, right? So patients, they may be having because of hepatitis or because of alcohol, they might get liver diseases, right? Because of that, they might get chronic liver disease. And the CKD, chronic kidney disease paper, right? So they might have this problem, right? Then comes, yeah, right? So then you, likewise, you have to have a clear understanding which system might be affected, right? So then you have to, then you can come into a nicely working diagnosis. Then the etiology. So what is etiology? So this patient may be due to alcohol. So maybe due to alcohol, he has got a chronic liver disease. Maybe due to sexual promiscuity, they might have got hepatitis B or C, right? So likewise, you can have a, right? Right. Then the complications. So what are the complications you can get, right? So you have to ask about the complication. For example, these patients might have portal hypertension. Then with the portal hypertension, they might get hematemesis and melena, right? So melena. Then the patient might get hepatic encephalopathy. So what is hepatic encephalopathy? Now they might have altered behavior. So patient might be not in a sound mind. There may be day-night reversal, right? There may be day-night reversal, right? And patient might be confused, right? So then sometimes the patient might be having hepatorenal syndromes, right? So decreased urine output, uremic features might be there. There may be spontaneous bacterial peritonitis. So worsening of ascites, abdominal pain, fever. So likewise, those things can happen. So those are called complications. Then the current situation, right? You have to ask about number of hospital administration. Have you undergone any surgeries for this? Any blood transfusions? Likewise. So this slide, students, don't worry. So this is like you need to have you need to read more to gain this knowledge. So don't worry about this. Now today in this lecture, I told you I will give you a skeleton. So don't worry about the things I said, right? So here you need to have understanding in history of presenting complaint. This is a very important slide, right? So you have to understand what are the things you have to do. You have to analyze symptoms, and you have to know about exclusion and inclusion of differential diagnosis, then the etiology, then the complications, and the current situation, right? So these are the things, right? So write these things down, don't worry. So we will when we are talking about separate diseases, we'll learn about these things more, right? Good. Now I told you, when you're analyzing, symptom analysis, there are 7 features of every symptom, right? So you have to ask about, right? You have to ask about what? The location, right? Now if somebody is saying like pain, you have to ask about where is it? Does it radiate? Now for example, if somebody is coming with chest pain, right, you have to ask, can you show me where is the pain coming from? Right? He might say retrosternal chest pain, right? It's radiating to the arm, right? Left arm, right? So likewise, you can have an idea. Then the quality. What is it like? Is it a constricting type pain? Or what is the type, right? Pricking type pain. Then the quantity or the severity. How bad it is. Is the pain, you can ask like scale. Can you rate it on a scale of 1 to 10, right? So that is the quantify, like severity. Then the timing. When does it start? How long does it last? Like how often does it occur? So likewise, the timing you can ask, right? So when the setting in which it occurs, right? You have to ask about when you are stressed, or do you get it this, like when you're doing activities, when you walk, do you get this chest pain? Likewise, you can ask, right? Remitting or exacerbating factors. Like exacerbating means the symptoms getting worse, right? Now for example, if somebody is giving asthma, so asthma may be exacerbated by viral infections, right? So can be exacerbated by smoke. Like you have to ask, does it make does anything make it better or worse? You have to ask those things, right? Then the associated manifestation, whether it's associated with nausea, sweating, right? So whether it's associated with any other symptoms, does it accompany with it, right? So likewise, you have to ask. So 7 features of every symptoms you can ask, right? So location. So here also, when you there's a mnemonic call, you can Google and see Socrates, right? So when you talk about abdominal pain and any pain, you have to have this you have to ask these features of every symptom, right? So this is very important in analyzing, right? So in the history of presenting complaints, what is the first thing I told you? Symptom analysis. When you analyze these symptoms, you have to ask these questions, right? Good. Right, so now let's go back and see. Now what is the first thing in the skeleton? Patient profile, right? Patient profile. You have to ask about the patient profile. Then the presenting complaint and duration. I told you not to miss the duration part, right? Right. Then history of presenting complaint. So now you have analyzed the symptoms. Then you have to know about what are the systems can be affected, like differential diagnosis. Then you have to ask about etiology. Then you can ask about complications, right? So whether any complication has happened and the current situation, right? So this is called history of presenting complaint. So history of presenting complaint. So in the history of presenting complaint, there is something called symptom analysis. In the symptom analysis, you have to analyze 7 features of every symptom, right? 7 features of every symptom. Right, good. The next thing in the skeleton is the systemic review. Like you have to ask about each and every systems you have to ask, right? So this is not you are examining, right? This is you are asking, you are talking to the patient and you are asking these things, right? For example, you can ask general questions like, do you have loss of appetite, loss of weight, right? So those are significant, no, right? Right. Then the cardiovascular system, right? You have to ask about chest pain. Do you have any chest pain? You have any exertional shortness of breath, right? So then what is the importance of this? If it's a chest pain, you know, right? If a patient is coming with chest pain, it's until proven otherwise, it may be a myocardial infarction. It may be a unstable angina, right? You need to have an understanding of how to differ myocardial infarction from unstable angina and what is acute coronary syndromes. Don't panic, I will teach you, right? So you need to have, so first thing to differentiate from these things, you have to get a clear understanding about these things, right? So chest pain you have to ask. So now chest pain and it has complicated with heart failure. So then when a patient is having exertional shortness of breath, the first thing has to come to your mind is heart failure, right? So then shortness of breath, right? You have to ask, right? When there's, if they say yes, you have to go through that. Now for example, now you have to ask about when a patient comes with heart failure, you have to ask about what? Orthopnea. So you can ask like, do you keep how many pillows? Like you do to sleep, do you need 2-3 pillows, right? So the patient cannot lie down in the bed, right? So then paroxysmal nocturnal dyspnea. So those symptoms you have to ask, right? So chest pain, exertional shortness of breath. Then the respiratory system, you have to ask about cough, you have to ask about shortness of breath. Then the GIT, constipation and diarrhea, right? So very important. Then you have to have genitourinary system, right? You have to have micturition. You have to ask about lower urinary tract symptoms, like, so micturition, do you have any trouble urinating, right? Any rashes in your body, right? Do you have any ENT problems? Do you have any headaches? Do you have any eye problems? Do you have any ear problems, nose, throat? Those things you have to ask. Then any endocrine problems like hypothyroidism features, right? Hypothyroidism, hyperthyroidism, right? Then you have to ask about hematologic, like lot of things like hematologic. You can ask about anemic symptoms. So anemic people might come with shortness of breath, like they are very tired, they have dizziness. Those things you have to ask. Then you have to ask about psychiatric, right? Any psychiatric symptoms, like any is there any do you hear any sounds without any person, right? So likewise you can ask about what delusions, you can ask about hallucinations, about the mood, right? Likewise you have to ask, like this is called systematic review, right? Systematic review, right? So you have to ask about every system, and then you can get you will not miss anything, right? Good. Right, then comes the next important thing, past medical history, right? Past medical history means what? Here also there is a pitfall. You have to ask about duration and control. Like for example, now if somebody tell me this patient is having diabetic mellitus, it's just a data, right? But I want the information from that, right? So information means, so now if say now listen to me, if somebody is presenting like this patient is having diabetes, the other person is presenting this patient is having diabetes and he has been diagnosed 3 years back, and this patient's compliance is good, and he has good clinic follow-up, so then I know this patient is having good diabetic control, right? So now you have to ask about these factors, right? So when was it diagnosed, right? Diabetes, when was it diagnosed, right? So do you have a good compliance to drugs? So good compliance to drugs means like this patient is takes medication every day, right? And then not the defaulted clinic follow-up. So you can say some people doesn't go to clinic follow-up, so you can say defaulted clinic follow-up, right? So that the hypertension, right? So the hypertension is also same. So when was it diagnosed, right? Does this patient drink medication every day? Does this patient goes to clinics, right? Likewise, right? So ischemic past medical, do you have any ischemic heart disease history, right? Any history, right? Any chest pains? Then you can ask about bronchial asthma, like have you been diagnosed as asthma, right? So do you take inhalers, right? So is it a blue inhaler or brown inhaler, right? What is your compliance? Do you go to clinics, right? So that when was the last attack? When was the last attack you got, right? Then the epilepsy means like it should be diagnosed by a consultant, right? So epilepsy, you have to ask about epilepsy. Do you get any fits or convulsions? Like have you been diagnosed with epilepsy? You can't just say if a patient get a convulsion, you can't say this patient got epilepsy. So that's wrong. So it should be a diagnosed one, right? So so diagnosed patient only you can use the word epilepsy, right? So other ones you can say convulsions or fit, right? So then the life-saving question, right? Any hospital admissions in the past, right? You have to ask this in past medical history. For what? When? Right? So these are very life-saving questions, right? So in past medical history, what is the important thing in this slide? You have to ask about the duration and the control, right? So duration and the control, very important, right? So diabetic, so I told you, I don't want data, I want information, right? For example, now if somebody is saying that this patient is having diabetes, useless, right? So when that means like you have to tell about this patient is having diabetic, he is having good control, and he's the compliance for drugs is good, and then you can tell he is having good clinic follow-up, right? Right, good. So then the past surgical history. So past surgical history is also, again, I need information, not data, right? So any past surgeries. So what was the anesthesia given? So general anesthesia or spinal anesthesia or local anesthesia. Delayed recovery from general anesthesia, this patient after that surgery. Any post-op complications, like whether this patient had bleeding, whether this patient had the post-op fever, right? Those things are very important. Like post-op ICU admissions, right? Very important. Then you can ask for the old diagnosis card and you can see what are the things they have done in past surgeries, right? So very important, right? So past surgeries, past surgical history, right? Good. Right. Next, the family history. You have to ask like any family history of suspected disease, diabetic, hypertension, ischemic heart disease, right? Those things you can ask whether this patient, like for example, if somebody comes with chest pain, you can ask, did your father get any chest pains? If the father is alive, like you can ask about whether your father did your father get any chest pain, and have been diagnosed by ischemic heart disease, right? For example, is it an unstable angina, is it a myocardial infarction? Likewise you can ask, right? And then you can ask about diabetic, and you can ask about hypertension. And this when you are talking about family history, these pedigree drawings are very important, right? Pedigree symbols you should know, right? So for pedigree, so females it's a circle, right? So you draw a circle, right? For the males you draw a rectangle, right? So rectangle, the square, right? So for females you draw a circle, For males you draw a square, and then you can so now when you see so you are a male, and it's a square, and if somebody is deceased or dead, right, so you can draw a diagonal line used to show that this person is dead, right, like this diagonal line you can draw. So you please use these symbols, right, so study more, don't read more about these symbols, and then you can draw these pedigrees, right. Good. So next comes the drug history. So drug history, what drugs you are taking? Are you on aspirin, clopid, right? The warfarin, so very important. So are you on, so like for example, if somebody is having asthma, right? So the what type of inhalers you are taking? What are the inhaler techniques, right? Do you take it every day, right? Likewise, you have to ask the compliance. So do you know which color inhaler you should take every day? Likewise, you have to ask, right, about the drug history, right. Then the allergic history, very important, right. So food, drug, plasters, like you have to ask, do you have any allergies for these medications? Panadol, paracetamol allergies, right. So augmentin, like any food allergies, any plaster allergies. So very important, the allergic history, these things. Always remember food, drug, plasters, right. So in allergic history. Next comes the social history. So again here you need to have understanding why you are asking these things, right. In social history is very important, it should be relevant to your history, right. So you can ask about this marital status and children. So why do you ask these things? So you ask because like is there any person to take care of you after you underwent this surgery, right. Likewise you have to ask. Then alcohol, right, alcohol. So it's useless like saying like this patient is alcoholic, and so you can't even use that word alcoholic. But you have when somebody is telling about alcohol history, you have to tell how much and for how long. Now for example, you have to tell this patient is taking half a bottle of arak every day. So then that's information, right. So then you know there is something wrong with this. Now this patient is got generalized edema, and this patient is taking every day half a bottle of arak. Now you know that there is something with the liver, right. So likewise, then the smoking. It's like smoking, you have to say this, you can't say this patient smokes every day. Likewise, you have to say, so you have to count pack years. In the next slide I will teach you how to count the pack years. Likewise you have to ask like how many per day, and for how long have you been smoking. So likewise you have to ask. Then you have to ask the closest hospital and the distance to the closest hospital. Why do you ask? If there is an emergency, you need to have a clear understanding of whether this patient can come to the hospital or not, right. So then if now for example, if somebody is having asthma exacerbation, so there should be a nebulizing facility in this hospital. Like this patient should be able to admit. Like if it's far away, then you have to write a referral to a nearby hospital, right. Then occupation and income, you have to ask whether this patient is the sole breadwinner of the family. Sole breadwinner of the family means he is the only person who's gaining income for this family, right. If he underwent on a surgery, now what happens to this income? So how does these children get food? To get that, you need to have a understanding about the occupation and the income. So then the next question you have to ask is, do you have a vehicle at home in an emergency, right. So again, like the closest hospital and the distance to closest hospital is relevant to this question. So in an emergency, you should be able to come to the hospital, right. So then the next question, you need to ask about the patient's knowledge about this condition, right. If he doesn't know, have any idea about this condition, you have to teach them, right. So that is an important part, right. So social history. So these are the very important things in the social history, right. So as I promised, I told you how to take in social history the pack years, how to count, right? So in one packet there are 20 cigarettes, right? So you have to ask about number of cigarette smokes per day, right? And you have to multiply it by number of years of smoking and divided by 20. For example, now if you take, so you can write this down. And for example, now if says a smoker of 10 cigarettes a day who has smoked for 15 years, now if you calculate this, 10 multiplied by 15 divided by 20, then you get this 7.5 pack years, right? So likewise, good. Then you can say this patient has a history of 7.5 pack years. So it's a very good information for the consultant or your senior, right? Good. So right now, I hope you all got a brief understanding about this history taking skeleton. Once again, I will tell you the take home messages, right? So this is one thing. So you cannot mix up the words, right? What is history, examination, investigation, treatment, right? So these things, this slide is very important. So today our focus was on history, right? So then I told you, right? So with the help of history and examination, you get a working diagnosis. So why do you do investigations? You do investigations to confirm the working diagnosis and to find etiology, right? So then you go for the treatment. So these are the few steps you need to have a understanding, right? So then the skeleton of the history, right? First the patient profile, then comes the presenting complaint and duration. I told you, don't forget the duration, right? Presenting complaint and duration. First patient profile, then the presenting complaint and duration, right? Then comes the history of presenting complaint. So in the history of presenting complaint, you have 5 things, right? Symptom analysis, exclusion and inclusion of differential diagnosis, then the etiology, complications, and the current situation, right? So then I spoke about 7 features of every symptom. So location, quality, quantity, and the timing, and then the exacerbating factors, and then other manifestations, right? Associated manifestations, right? Then the systemic review, right? Systemic review, right? You have to ask about the cardiovascular system, you have to ask about respiratory system, and you have to ask about basically every system, right? Then the past medical history. So I told you about the past medical history. You just don't ask about diabetic, hypertension, ischemic heart disease. So you have to ask about the duration and control. Now, for example, I told you about bronchial asthma. When was the last attack? So are you on inhalers, right? Do you go to clinics, right? So what is your compliance, right? Have you been diagnosed with epilepsy, right? So when for diabetic mellitus, you have to ask about when did you when was it diagnosed, right? So do you take drugs every day? What is your control? Do you go to clinics? Likewise, you have to ask past medical history. That is the important thing, right? So I told you, we need information, not data, right? Then past surgical history, right? Then the past family history. So pedigree symbols you need to have a clear understanding. Then drug histories, right? So allergic histories, food drug plaster, food drug plaster, food drug plasters, right? So then the social history, right? So these things you don't just ask, right? Why do you ask these things? To get data and to produce information, right? So why do you need to produce information? Why do you need to produce information? I told you this slide, right? So from the history and examination, you can come to a working diagnosis, right? So from if you have information, then you know, like, there is something wrong with this patient. This patient might be having this disease, right? So that's what. So I hope you got a clear understanding of the skeletal of history taking. So now in next video series, I will take one by one diseases, and I will give you examples of history. So now please read more regarding histories, right? History taking, skeletal, right? Practice what are the things, right? Draw this skeleton in your book, and there are salient points now I told you. So memorize those things, okay? All right. Thank you very much for listening my lecture. If you have any questions, you can contact me and ask, right? Thank you everyone. Goodbye.